Welcome to Kaumudy Global. The test result that the death of a 22-year-old man who came to Thrissur from UAE was due to monkeypox has raised a new health threat to the country in general and Kerala in particular. Experts say that this disease, which the world sees with fear, is not so deadly compared to other infectious diseases. Even then, there are things to be afraid of. The fact that the country's first monkeypox death occurred in Kerala cannot be considered our fault. The reason is that the young man was diagnosed with the disease even before returning to Thrissur from the UAE. It must be assumed that the young man who came home did not understand the severity of the disease. He was interacting freely with his friends, family, and acquaintances. He reached the hospital on July 27th when the disease was in a critical stage. The disease worsened and he died on the 30th. The sample was then sent to Alappuzha Virology Lab for diagnosis. The examination revealed that the young man was suffering from monkeypox. 22 people, including family members who had close contact with the young man and others who were in contact with him, are now under the observation of the health department. So far, there is no indication that anyone has been infected. Wherever there is a report on infectious disease like this in the world, it is said that our state Kerala should be extremely careful because Malayalis are said to be all around the globe. Many Malayalis are constantly traveling for work, business purposes, study, world tour, etc. This makes it possible for infectious diseases to spread easily. If the results of the test done by the Thrissur youth in the UAE had been informed to the authorities immediately after he returned to the state, the health department would have taken appropriate steps. This young man has committed a serious mistake to the society and himself by hiding the information about his illness. It can be said that during the COVID period, the strict inspection systems introduced by the government at the airports prevented the transmission of the disease to a certain extent. Now that the threat of COVID is over, there are no such tests anywhere in the country. When the monkeypox menace broke out again, alert was issued but no special measures were put in place at the airports. Those who have even the slightest suspicion of having the disease should avoid traveling as much as possible. Or if the journey is necessary, at least show the prudence to be admitted to the hospital immediately after landing. It's a responsibility not only to the society but also to one's own family and relatives. Monkeypox has now been confirmed in more than 60 countries worldwide. The virus does not present any health threat created by COVID, as it can be treated and cured even if the disease is contracted. The death rate of monkeypox is not alarming. However, the disease shouldn't be taken lightly. Any infectious disease is a threat to the world. Such a health emergency is definitely a big challenge for Kerala, as lakhs of Malayalis are expatriates. Meanwhile, the latest in the news regarding monkeypox in Kerala is that the health department has detected a 38-year-old woman with symptoms similar to monkeypox in Wayanad. The health department informed that the woman has been put under observation. The woman arrived from the UAE last month. She had sought treatment at a private hospital after experiencing physical discomfort. She was later shifted to the Manandawadi Medical College after she experienced some symptoms of monkeypox. The samples of the woman have been sent to Alappuzha for lab testing. A young man had died in Thrissur after being diagnosed with monkeypox, whereas the 35-year-old native of Kollam who was diagnosed with monkeypox for the first time in the state has recovered. This is Anjana signing off. Do like and share this video. For further updates, subscribe to Kaumudy Global.